he had said, if there was one thing that I would only do for the rest of my life, if I was just handcuffed to one thing, it'd be NAD IV therapy.
Oh.
And when I heard that, it changed my mind on everything.
The NMN supplementation led to a significant reduction in blood pressure, improved cholesterol profiles compared to the placebo
That's
group.
cool.
Improvements in the vascular function and reduced arterial stiffness, meaning that it has a little bit more give, thus also less plaque, less cholesterol buildup, lowering cardiovascular risk. Muscular endurance increased by 30%. And then even compared to a 5% increase versus the
That's
placebo.
significant.
And sarcopenia, it would
Yep.
probably help with. It would help with higher NAD levels can improve cognition, mental function. It has even a protective mechanism against some of these neurodegenerative diseases.
That's crazy. This is like something I just want to give to everyone who are going through stages of change, any stage of change in their life, trying to improve anything. I feel like this is just an underlying foundational boost for you.
I love that.
Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Welcome back, everybody, to the Functional Code. Today, we have an exciting podcast for you guys. We're going to be talking about nicotinamide adenine dinucleotide, also known as NAD. And I think a lot of people are very familiar with NAD if you're into the longevity crowd, the alternative health realm. It's super, super effective for so many different things. I actually knew about it a really long time ago, but I actually was just introduced to it via another provider I was learning about NAD from, and just how amazing this is. And I didn't realize, me and Doc were getting into conversation just about how much he had actually studied about it prior to us meeting. And so super excited. Doc had a bunch of research and information that we're going to be giving to you guys today. So super excited to hear from you, Doc. As always, I am Dr. Addy.
And I am Dr. Jace. Yeah, we're going to go into a little bit of how this NAD, NMN, NR is all processed in the body, so you have a general understanding on the reasons why. Then we're going to go into how certain areas of these therapies benefit not only the whole body, but also the long-term aspect, and then other therapies and or modalities used with and alongside of these therapies as well. So this is going to be fun. If you guys have never heard of NAD therapy, there's a lot of decent research of humans, definitely a lot of animal models of the positive effects it can have. But I'm going to go into some of the other areas in terms of how it processes within the body. So whether it's supplementation route, whether it's IV route, we're going to get into more specifics with that, but those are the main ways that you can administer it into the body. Now NR, so that is a precursor, and then it moves to NMN, and then moves to NAD. So when you're looking at supplementation route, there's different lines of literature and different companies that will say certain things, how it processes in the body, but more so than anything else, if you work downstream, so like NR, it's going to take more chemical processes to work into NMN, to work into NAD, where more of the main use is the NAD itself. And we'll have a whole chart up so you can see how it's worked into the body, especially energy-wise. A lot of this is processed through the Krebs cycle. So that's where a lot of energy can be picked up, and so it can be used to funnel into not only the maintenance of the body, energy, even cognitive, mental aspects as well. So
even mitochondria stuff too.
Mitochondria stuff, yeah,
Yeah.
absolutely. So as we go through, ideally when we first start, whether it's NR, whether it's NAD, all that will be absorbed through the digestive tract, and then it's going to be transported to protein cells, to where then it goes through like a whole enzymatic conversion, then goes to NAD, so it can be utilized for the energy or for these other benefits throughout the body. So more times than not, supplementation route, for more companies, they tend to go towards the NMN route, just because it's one less step of conversion from NR to NMN to NAD. So that's more or less the reason why. Now, if you have the availability, it's a little bit more spendier. NAD, IV, way better effects. And that's where you start seeing like some of these famous individuals, whether it's the Kardashians, whether it's sports athletes, they use this on a consistent basis for the overall longevity of their body and for other aspects we're going to get to as well in a second. Now, over time, we've started noticing through blood levels, NAD decreases with age, which can lead to a bunch of problems in terms of the tissue or DNA damage and just even energy and cognitive function. So this is a huge underlying molecule that will help for the long-term aspect, especially if you want to maintain the cognitive function and your overall body performance long-term. What are other aspects that can help with the body? Before that, Doc, is there anything you have to add on there?
No,
before
I
we get
know
into
that when I first started looking into this, I was approached by a company at a seminar, True Niagen, and I think they're a pretty well-known NR supplement company, and they really like to put just how much NR is better than NMN. And I really didn't know too much difference at the time. I still, again, this is just not something that I've chosen to study too much about, but I'm excited to get to dive into all of this with you today. But what I do know is now, after hearing about it and seeing and hearing just all the things that it can help with, I went back into the research a little bit. And towards the end of the podcast, I know that we'll dive even deeper into the differences between the two in some detail. But I do know that there is a lot more information now on NMN than there was prior, and maybe even showing NMN as maybe more superior to NR. And that was interesting because when I was approached by this company, they had said how NR was superior. And so there's not this back and forth of what to take, what to do. And then, of course, we'll get to the end of the pod too when I talk about Dr. Conover, who I've been studying a lot of lately because he does, I can't say the word on this podcast because I'll get censored, but he uses a certain compound. They're little compounds that are incredibly effective at healing. But also he does NAD, just the IV. And he's saying how that's way more effective. And so it's trying to break this down and break this apart. I'm excited to hear from you just the benefits of all of them and what that looks like as far as NMN in the body, NR in the body, and then just NAD alone. Why that's, when you break them apart, they're probably all three effective, but it's good to know just why, for example, NAD would be a greater enhancement of just then taking oral supplements anyway. Yeah, Doc, benefits of NAD plus, and obviously supplementation of NMN, even in the body. What does that kind of look like briefly? And then what do we see as far as improvements when we can actually get this system to work and really churn out high amounts of energy for us?
I love it. So when we look at the high amounts of energy and how that's produced throughout the body. So I know we said that it absorbs through the digestive tract. There's cellular respiration that can help for the mitochondria, which create energy throughout the body, and influencing those will have a significant impact for the energy throughout. So NAD, it pretty much accepts the electrons during the breakdown of nutrients and or these supplementations coming into the body, and then that gets converted to NADH, which then goes through the electric transport chain, which creates ATP, or these small energy molecules. So that's more the reason specifically why enhancing the NAD levels provides the body with more enzymes to where you can create more energy or more ATP throughout the body. And that has positive effects, whether it's energy, whether it's physical performance, stamina, reduces fatigue. There's a lot of small things with that. Now, the cool, unique part is subsequently, it also helps with DNA repair, which I thought was interesting, and also
fascinating
cellular longevity as well.
Fascinating. When I know we talked a little bit about this on I think we had a longevity podcast back in the day too, and I know that we talked about Sinclair and all these other longevity guys, and I think we'll even get to the end of just their protocols too of why they choose to use these supplements for longevity. Now, was there any studies that you had provided for showing any potential in these therapies moving forward?
Absolutely. Yeah, and going back to the point with David Sinclair, he's leading the charge, especially in this NAD therapy. He's a researcher at Stanford, and he's been using this long term. He also had his dad on it on some of these therapies, and his dad has little breakdown throughout the body. His dad increased his energy output, is able to work out for longer periods of time with no negative effects. So when you look at the long-term perspective from a small case study there, just that brief example, it shows huge implications.
And everybody wants that when they get older, especially if they want to still stay
Mhm.
active. I know that this is something
Mhm.
that many of my patients have come to me, even family members, as a need to improve that part of their life. And to be honest, I would even enjoy some of these
Ooh,
positive
yes.
effects after hearing this. So,
Mhm.
very excited to hear more about what research they've done on certain conditions, and then, of course, what those outcomes were.
Beautiful. So going back to that DNA repair, NAD is crucial for activating this PARP, which is poly-ADP ribose polymerase enzyme. It's just a crucial role for the DNA repair. Now, how Sinclair explains this, and he probably explains it way better than me, in terms of each DNA has these spools, which are broken up into, they're just a small little bits of the aspects of DNA. And Hughes almost explained it as like a cassette tape on how you can tighten up the spools so they don't necessarily come apart, thus for less activation or DNA breakdown. So it's almost tightening up the spools of how it holds that DNA in place. And that's one of the ways I can go about it.
Yeah, I know that they have a direct impact on NAD plus itself, and I
Mhm.
know through activating sirtuins, you can protect DNA integrity and improve aging somehow, some way.
Yeah.
I think we talked about that a little bit too on the longevity podcast, but
Mhm.
I think regards to aging, there's like a bunch of sirtuins. I don't know how many of
Oh
them,
God,
but I
yeah.
know a lot of them are expressed positively in regards to aging, but not too
Yes.
specific. I don't have much
Mhm.
information on the specificity of that.
Yeah. If anything, go look at Dr. Sinclair's work. He also put out a few podcasts. I think this is 2022 or a few years back, and he explains everything quite well. He did a whole series on that one, so YouTube that one for sure. But in terms of DNA repair, there was actually a study in 2024, and it was more on the NAD depletion and aging and how everything worked together as a whole, which has a huge impact on the vascular endothelial cells. Now, they put vitro cultures and they're exposed to oxidative stress. So it can simulate certain aging conditions. And then they implemented NAD supplementation and also NAD therapy under those conditions. It helped for the cellular damage, thus also helping with the aging. So the NAD levels in the treated cells preserved about 40% compared to the untreated cells, showing potential for NMN and anti-aging therapies.
Dang.
So that's just one aspect on terms of how NAD can help for the longevity of DNA.
And I know that so many longevity followers, they are heavy on this stuff. And they, among other things too, which I know we're going to get to in a little bit of what else you can do alongside of this stuff. But
Yes.
I know so many people who are in those circles who are trying to stay healthy, but not also prolong aging. And I think most are using an NMN supplement daily or doing NAD therapy weekly, monthly, and continually doing that because they do know the research is there, but also they feel the effects, which is the cool part of this. I'm excited to get
Yes.
to too. I didn't realize just how incredible the results were with NAD therapy
Mhm.
and just some of the things that Dr. Conover was one that I loved hearing. He had said, if there was one thing that I would only do for the rest of my life, if I was just handcuffed to one thing, it'd be NAD IV therapy.
Oh,
And when I heard that, it changed my mind on everything because he does so many different things. And to hear that really changed my perspective on just the value that this could be
mhm.
given for patients. So super interesting. No, Doc, what kind of effects does it have on the inflammatory system for NAD?
Absolutely. And this will affect everything from certain conditions for arthritis, certain cardiovascular issues, even like some neurodegenerative disorders, which I'll get into in a second here. But a lot of this will help from the immune cellular function, which then helps for the chronic inflammation state. Now, some of this is also related to when you age, certain NAD levels in terms of energy output, they diminish over time. So even starting supplementation 30s and on up from there will have better effects long term, especially if you take it for a period of time. I don't think there's any studies in terms of the dosing and the frequency, because I know in past podcasts we've brought up certain dosing on supplementing, whether it's 5 days on, 2 days off, or you supplement for 8 weeks at a time or 6 weeks at a time. You take 6 weeks off. So I think some of that might play into how your body absorbs these small enzymes and these small molecules, but that's just something that we still have more that we need to find out from there. But in terms of this study on like cardiovascular health for adults, there's a study by Yamato in 2023, and this is out of Frontiers in Aging. They did a randomized control trial involving 50 older adults ages 60 to 75 with pre-existing cardiovascular conditions. The participants were given 500 milligrams a day of NMN for 12 weeks, while a control group received a placebo. And they looked at blood markers, they looked at blood pressure, cholesterol, and NAD levels were also measured at baseline,
Okay.
midpoint and endpoint, so they could see how everything was absorbed. And they noticed that the NMN supplementation led to a significant reduction in blood pressure, improved cholesterol profiles compared to the placebo
That's
group.
cool.
So even just the systolic blood pressure dropped on an average 8 millimeters per mercury, and a total cholesterol decrease of 15% compared to the other
That's
group.
substantial.
Just supplementation.
I would love to try that
Mhm.
instead of using a blood pressure med first.
Oh, God.
I mean, that's
Mhm.
incredible.
Absolutely. Even when I took some of the, so I tried a few different supplements of NMN specifically, and I've done IV therapy through NAD. Through about 3 different types of NMN supplementation, the one that I noticed huge effects personally was the one that they had, and I can't remember the exact company, but they required you to keep it stored in the fridge.
Okay.
What that did, I'm not 100% sure, but noticing way more energy, way more mental clarity, less fatigue. Like it was a complete difference from the other 2 of the NMN supplementation. And then that same one that was refrigerated, I also had the similar effects for the IV from just NAD. Small testimonial on that one, but you talk to any other patients or people that have done NAD IV therapy, or some people that have done NMN supplementation, more times than not, they're going to see an awesome positive effect from
Yeah,
there.
I know Conover was explaining a lot of the testimonials that his patients obviously gave him, but some would say that it was the greatest change in overall health that they've ever experienced from a therapy
Wow.
over a course of treatment. And it makes sense. He explained it as almost like a systemic reset for your cells, and really just giving them this enhanced ability to do their job and improve your overall system as far as a healing aspect, as far as an energy aspect. And it doesn't come without a little bit of pressure and push to you. I know that he had said there are some symptoms that come along with doing NAD therapy, but they're short-lived. But he did say that you're going through a period of stress and struggle. We're really pushing these cells to be better and improve. Some experience a little bit of heaviness on their chest and legs. Some of them were a little shortness of breathing, but it's almost ramping you up, and go through the pain, and out comes the light after that. But that actually, it doesn't scare me at all. I actually some people like to feel a little bit of struggle before they see their improvement. It's almost like you have to go through the pain to get to where you got to get to. Just hearing that, I know that there was such an incredible change going throughout the body doing those kinds of things. Obviously, since you're having those kinds of symptoms through treatment, but yeah, super, super interesting. Doc, this next study I know you provided showed changes in vascular health with women. What were the outcomes?
So through Lee et al. At 2023, This was in Menopause Journal. They did a cohort study of 6 post-menopausal women, which was divided up into NMN group, which received 500 milligrams per day, and then a placebo group. Over 10 weeks, they noticed vascular function was assessed using ultrasound and then tracking just endothelial function and arterial stiffness. So mainly for some of these right now, what we're talking about is the improvement of the vascular arteries, veins, and also how certain chemicals are delivered to the body. And that's where you're going to start noticing some positive effects. With this study specifically, it led to positive improvements in the vascular function and reduced arterial stiffness, meaning that it has a little bit more give, thus also less plaque, less cholesterol buildup, lowering cardiovascular risk. So it actually improved endothelial function by 25% and decreased arterial stiffness by 18%.
That's incredible.
Compared to
I
placebo.
didn't realize it had such a profound effect
Mhm.
on the vascular and cardiovascular portion of the body. That's awesome. I would love to try this with so many other patients who are
Mhm.
struggling in that category. It's such a safe
Yeah.
measure too. People don't realize just how safe these kinds of treatments are to give a try versus going through harsher medications.
Mhm.
So next, doc, this was an interesting one too, talking about just it's a direct effect on muscle function. What kind of outcomes was included in this study?
So for NAD supplementation and muscle function in aging, and this is a study that I almost bought, quite honestly. So I went the ChatGPT route to give me the brief overview, or so I would dove into this even more. But so this is a study out of gerontology, to where they did a study of 120 adults over age of 65, divided in groups, giving 300 milligrams of NAD versus the placebo. They notice and they assess muscular strength, muscular endurance at baseline and after a 6-month period of time. Now, the participants that took NAD
Mhm.
supplements showed a noticeable improvement in muscle function and endurance, indicating that the supplementation might help mitigate some of these age-related muscular declines.
Damn,
Like muscular endurance increased by 30%. And then even compared to a 5% increase versus the
that's
placebo.
significant.
And sarcopenia, it would
Yep.
probably help with. It would help with just overall body function. So as it's delivery and helping out the vascular system, it's also having implications to some of the muscles and tissues, especially long term and some of the older
It's
individuals.
phenomenal. That's phenomenal.
Mhm.
I would only expect every gym rat to want to include this into their supplementation
Yes,
protocol. 30%, that's profound. I
that's
mean, that's
incredible,
profound.
especially just the supplementation itself.
I already want to take this every day
Yeah.
now that I hear all these things. That's so cool. That's awesome. So, Doc, I see that it also has been included in some neuroprotective / cognitive health studies, or at least showing some
Mhm.
benefits of that. What did you find in regards to improving cognition and other brain-based impairments?
So as it's getting delivered to the body, it's also going to the brain. So we're seeing that NAD actually has a positive effect on not only the energy metabolism in the brain, but also, and it also supports enzymes like SIRT or serotonin 1, which protects neurons from an oxidative damage, and then subsequently helps reduce neural inflammation itself there.
Wonderful.
So we're starting to see higher NAD levels can improve cognition, mental function. It has even a protective mechanism against some of these neurodegenerative diseases like Alzheimer's, Parkinson's, and just overall brain support and health of that.
That's incredible.
Yeah, so there was a couple studies, one of which there was a randomized placebo-controlled trial through NR in older adults, and especially when looking at mild cognitive impairment. And this is by Orr et al. In 2024 out of Neuroscience. So there was a 10-week period. The study enrolled 20 older adults, and they looked at, and the adults were diagnosed with this mild cognitive impairment, or MCI, and the participants were given either NR supplementation or a placebo. And the NR was noticed a gradual increase aiming at a final dose of 1 gram per day. So they started noticing that the blood levels in the NAD improved, the cerebral blood flow to the brain also improved. Additional like neurocognitive and psychometric assessments were also given as well. So in the study also showed physical performance of walking speed improved, and even just DNA methylation. The study looked at a bunch of things, but it showed that the improvement of NAD levels in older adults with mild cognitive impairments has improved the cognitive function. But there's also like longer trials needed for this as well. Just one study on this, but it showed great improvements. And for this cognitive area itself, there's a lot of studies on mice and a lot of studies on animals showing huge improvements of longevity in terms of mental cognition. And it also helps for certain individuals, or more or less certain animals, to help for the longevity. I just heard of a video, and this was a couple of years ago. There was a dog that was dying. There was some like neuro disorder, a cognitive disorder, and it prolonged. And I think that dog was given like a few months to live. Through consistent NAD therapy, the dog lived for another like 3 years.
Dang.
With consistency on that one.
Dang.
2 to 3 years or so. But yeah, so we're seeing in animals, there's more being done in humans for positive effects there. But yeah, there's so much improvement with that.
Has such a huge effect on pretty much all parts of the body, is what we're already seeing.
Oh,
and that
God,
makes sense
yes.
because it's affecting it at the smallest form, cellular level. And anytime you can improve cellular function, you're going to just have outcomes all over. The question is to what extent of outcomes are you going to get with each part of the body? And that's obviously where the more research is needed. But what we already know is it's probably going to affect most things.
Oh, God.
Question is just how much. And it's just such an easy thing to supplement safety wise, and it's more than likely oral for NR and NMN, but NAD is going to be intravenous most of the time. But other than the tiny little prick that you get in the arm, and then just some of the symptoms that you're going to be having during the treatment, they don't last that long. And I think this is just such a non-invasive way to make such a profound impact on your health. And some of the changes that I'm seeing, I very rarely have seen these things in medications even sometimes.
Absolutely.
So I'm curious to see what other protocols we're going to build another 5 to 10 years out, and what is that going to look like, especially on so many other parts of health. So Doc, I know moving into more of the metabolic health, what can NAD do to play a role in regulating, obviously, patients who have metabolic issues, meaning they're maybe overweight, they have insulin issues, glucose, those kinds of things?
So we're even starting to see with certain areas of research, especially newer studies, that it's helping regulate insulin sensitivity and just even like the glucose metabolism. So as it's getting delivered through the arterial system, going to not only the muscles, some areas of the heart, the brain, along with it, it's helping with glucose metabolism, especially in the liver and muscles. Through some of these supplementations, especially NMN, it helps re-regulate blood sugar, improves metabolic function, even for people with obesity and type 2 diabetes, like you said. It's a cool study. It's by Brown et al. In 2024, and this is out of BMC Endocrine Disorders. So this study assessed 80 adults with metabolic syndrome. They were randomized and received 250 milligrams per day of NMN versus the placebo for a 16-week period. They also looked at areas of insulin sensitivity, glucose levels, lipid levels were also monitored. They noticed NMN improved insulin sensitivity and lowered fasting glucose, which would subsequently lead to helping for people with diabetes.
Yes.
Insulin sensitivity improved by 28% in the NMN group, and the fasting glucose dropped by 12%, which 12% is
so curious to see patients who are either overweight, having issues dropping weight, having issues with type 2 diabetes, type 1 possibly too, but what that actually
Mhm.
would give patients if they're struggling to drop weight or even making certain changes in their diet. 30%, that's remarkable. I can't remember what sensitivity change people are getting with like tirzepatide and other like weight loss drugs too, but 30%, you're going to
It's
have
quite low.
such remarkable change with that. And that's 16 weeks. Man, that's crazy. That's something this is like something I just want to give to everyone who are going through stages of change, any
Mhm.
stage of change in their life, trying to improve anything. I feel like this is just an underlying foundational boost for you.
I love that.
That's it. This is fun to see.
100%.
This is so fun to see. This is like I'm learning something new for the first time, and I this is just incredible.
And then there was another study by Wayne et al. In 2024 that also looked at insulin sensitivity, and they noticed improvements there. So there's two studies that backed each other up in terms of the results
Hmm.
from blood glucose regulation and also insulin sensitivity. So yeah,
Damn.
a little more proof in the pudding on that one.
So, Doc, what do we know about the challenges right now regarding NAD therapy?
Mhm.
So, do we have good dosages, or do we still need to figure a lot of those out? What other factors maybe impact the outcomes with this kind of therapy? And then I did talk a little bit about side effects, but are
Mhm.
there some things that people might expect using this kind of therapy? And then what other
Mhm.
things that should people understand before maybe jumping in and doing this themselves, or obviously asking a provider to help them?
So when you look at like the barriers for adoption, especially for the general public, I think there's definitely going to need to be more research because when you look at some of the lines, whether it's animal studies or human, all these vary in dosages. And I think that will vary depending on certain conditions. I think that will vary depending on probably weight, size as well, of how you absorb some of this as well. But in terms of the challenges itself, some of this, whether it's from my personal experience through the NMN supplementation on how I noticed huge effects on one, especially the one that was refrigerated versus the other two. But on the one that we noticed that had effects versus the IV, I think that has to be re-regulated quite a bit more, whether it's the dosing or whether it's whatever is packaged and put in with the supplement
Yes.
for the absorption rate. I think that is probably a little bit more important. So dosing is going to be one. The other one is going to be fighting some of these other side effects too for some people, especially if they're not educated. And that'll come in terms of like nausea or feeling of fatigue for a small period of time, which if you don't go push through that, and it can last for maybe for some people a few weeks before noticing the effects, that might deter some people as well, especially if they notice that it's causing them to be worse. That's a huge barrier
Yeah.
itself.
And we know if we're upticking cellular function, we're probably going to
Mhm.
be excreting more wastes, and
Yes.
those could possibly cause certain changes in the body
Mhm.
too. So knowing that, it's less of an alarm for you,
Yes.
but it's also a, hey, I'm going to maybe feel a little worse before I get better. Brave the storm. Good things are coming.
And so when you look at where the possibilities are for NAD, NMN, these type of therapies in the future, with some of the research that we know thus far, I am expecting to see more research along the lines of Alzheimer's, Parkinson's, and how these therapies can continue helping with that, especially larger cohort studies. Also along the lines of like cognition enhancement and aging, and going to even more specific fields with improving brain function from the cardiovascular health, and even for certain people with strokes and stroke recovery. I think that would be important to see. But if I was in the situation of having a stroke or any of these other cognitive disorders, I would probably start looking at this type of therapy for myself personally, not saying it's for everyone, but it can help with helping just completely with obesity itself, and what effects does that have for the long-term aspect,
Hmm.
liver health, skin health, even for like skin repair. We're starting to see some of that to help for the rehydration and some wrinkles, certain areas with wound healing, certain areas of cancer prevention and therapies with that, and even reproductive health. So there's a lot of areas that I think that this therapy needs more research in. And I think there's a lot of positive things that can come long term, especially when this is an area to where it helps for most energy cycles throughout the body to create energy for the chemical processes. You're just almost hitting it at the root source
For sure.
instead of targeting certain other symptoms along the way.
And that just, I think, further I guess not proves, but further indicates that
Mhm.
someone, if not everybody, could be using this supplement that will get probably anything that they're dealing with to improve or even have some
Yes.
change. I know you went through all of these things and it hit almost pretty much every bit of the body is in terms of category. I think the next step is knowing what dose and what route to take as far as supplementation versus IV, and then what that dose looks like, and then how long, and then
Mhm.
what other things that you could probably be doing on top of NAD therapy to help with all of this. Doc, I know that so many of these doctors and longevity experts aren't just doing NAD alone. They're
Mhm.
doing certain things to help improve, like you said, uptake and synergistic effects too. What else are people doing out there to synergistically affect the benefits of NMN or NAD therapy? And what does that kind of look like too?
Yes. Some of the areas that this therapy can use with other treatments, there's a few of these sirtuin activating compounds or stacks, if we will, whether that's resveratrol, which is a common one often used with NMN supplementation. Resveratrol, that's a compound found in red wine.
Mhm.
Most people, if you hear you drink red wine, it can help for overall health. You're going to need a lot of wine for it to help to have those positive effects, but almost so much so that it's almost impossible to drink that amount of wine. So when you look at sirtuin, which are pretty much proteins, they play a role in cellular health and aging, and NAD is essential for the activation of certain sirtuins or those proteins. So when you add NMN therapy, especially with resveratrol, it has a synergistic effect which will help for cognition, cardiovascular health, longevity. Those are two things that usually come together with the supplementation itself.
Yeah,
not usually
I've seen
IV.
that in ingredient lists for a lot of those supplements. A lot of them have resveratrol in with it.
Yes. Now let's look at the mitochondrial support through other supplements. Some of this, like CoQ10, or even alpha lipoic acid, or even L-carnitine, using those supplements along with NMN or some of these others will also have a huge effect for mitochondrial health, which will help support energy production. It reduces oxidative stress, and thus improving everything from muscle health, energy levels, and having a neuroprotective effect as well too.
Beautiful.
So I don't mind that. I'd almost look at that almost potentially for some people in place of potentially CoQ10, but that's
CoQ10's great too
Yeah.
for heart issues, blood pressure, a lot of other things too. I know Josh talked a lot about it on our pod with him, and
Yes.
how he even uses it as a substitute for certain medications because it's just
Yeah.
as effective for some of those things too, which is great.
So we add on some red light, cold laser therapy with this NMN that can only improve the mitochondrial
Right?
function itself there too. Systematically wise, and then the laser more locally. But yeah, no, I love that. Now, in terms of oxidative therapies, whether it's vitamin C, vitamin E, glutathione, so those are usually some of the common ones. Even N-acetylcysteine, that will also help for neutralizing these free radicals, which will then also help for oxidative stress and damage on the cells and DNA, thus not allowing for as much turnover of poor cells throughout the body. So improve skin health, but also helping for reducing full body inflammation and just even cellular resistance
Okay.
towards aging. Now, again, as we're going through some of these, compounding this NMN NAD therapy and R therapy with some of these, there's not as much research on all these together, but we look at the effects of one and the other and the potential use of these will only have a better effect
Yeah.
long term. So just
And there are plenty of
there.
providers doing this clinically, so we're seeing some information from them, from their experience too, but it is very person dependent, so
Yes.
just take that with a grain of salt. I'm super interested in the next one, metformin, because
Yes.
I've heard it's so interesting because this is a drug and it was used for diabetes, but
Mhm.
now has shown effects on aging. And so what is it? What is the research regarding metformin, and why
Mhm.
could it possibly help this pathway as well?
And yeah, Dr. Sinclair, he likes to use this metformin specifically with people even outside of diabetes, especially when we're living in a world where it's high sugar dependent
Yep.
to compound those effects. But metformin, like I said, is commonly used for managing type 2 diabetes, but also has shown promise in extending lifespan and cellular function by modulating the insulin sensitivity and reducing overall inflammation itself. Metformin metformin activates the AMPK pathway, which a protein that boosts cellular energy and production and reduces the age-related pathways. You combine that with NAD, NMN, it further enhances the metabolic health and the support for diabetes management and aging. So I thought that was cool on that.
I know so many people who don't have diabetes that are taking metformin just
Mhm.
because of the promise of extending lifespan and
Mhm.
improving cellular health.
Hmm.
But also, I think there's a lot of people out there that they've put their eggs into the basket of insulin sensitivity as the true driver of longevity. And so they're trying to optimize their insulin receptors for
Mhm.
as long as possible. And that is their foundation of why they think they're going to live longer and have a higher quality of life. So I know metformin has a great impact on improving insulin sensitivity
Mhm.
too. So that's interesting though, because again, I have a hard time thinking of using a drug as a preventative or
Yes.
long-term improvement of life, but it also makes a lot of sense to why this could be studied further for obviously anti-aging, metabolic,
Mhm.
and health benefits too. But that's super, super interesting.
Now let's combine something that's not a drug, something that you can do in terms of fasting or
Yeah,
intermittent fasting, or even just calorie reduction itself. Now, just calorie reduction or intermittent fasting can also stimulate this NAD production naturally,
nice.
which then increases reducing oxidative stress, improving DNA repair, all the stuff that we've been saying. Now, fasting will help NAD levels, which if you're then subsequently taking the supplementation, it can theoretically only boost the effects
For sure.
for all those areas long term as well. So that would be an area to where, like, let's say if you're in the obesity category, if you don't have as much energy, feeling lethargic, that would be something obviously with a provider monitoring the fasting for most people with this supplements, I think can have really good effects.
And it's
Um,
relatively affordable because you're
yes.
eating less
Hmm.
and cheap. You're
Yeah.
not buying a bunch of different things to try to help you. I love fasting. I've been doing it for many years, and I do think it's still one of the only things that truly, well, not only in research but in experience, create such a drastic change to the body for positive long-term effects. And I do think caloric restriction in itself is one of the only ways to boost your lifespan,
Mhm.
from what I've read in research. And again, it's relatively affordable since you're not adding anything on top of it. You're just
Yep.
taking it away. But that's awesome.
And yeah, even when you look at individuals like hunters and gatherers, or like how the human species evolved, they ate quite a bit at one time and then they fasted until they found their next meal.
Exactly. Yeah.
So that's built into our body, and I think that's something that, especially fasting for most people, maybe not all year round. If so, awesome, but maybe a part of the year to have your body try it. There's certain conditions that probably won't allow you to go into intermittent fasting. Cautious there, but for most other people, yeah, hugely important.
Nice.
Now, as we go into the next one, hormone replacement therapy. This one I thought was interesting on how hormone replacement therapy that can be used for estrogen, testosterone, growth hormone, which can also combat age-related hormone declines. But even with like hormones like estrogen having influence on NAD levels, you combine that with these NAD, NMN type of therapies, improving those declines. will have a really good effect, especially postmenopausal women or older adults that need bone density help, mood regulation, or energy levels. There's animal studies helping for mice, bone fractures. I think some of it is partially from that side of things, especially bone, but
Mhm.
with this hormone replacement therapy, I think that would be a potential option. If I was in that person's same perspective, I would want to ask a bunch of questions to different practitioners that I'm working with, but
Yeah.
yeah, not a bad
And
idea.
hormones are tough to manage, so you want to make sure you're using someone who doesn't know what they're doing, that they've been doing it for long periods of
Mhm.
time. But I know that there's a lot more men trying to do test therapy because it is so beneficial on their mood, on their energy,
Mhm.
on their recovery in the gym, building more
So
muscle,
true.
not only just for change in libido,
Mhm.
which I know a lot of other people still use it for, but just the other effects that they're getting. I know there's a stigma, had been a stigma around it for such a long period of time. I think it's getting better, but
Mhm.
that alone, people don't really understand how much vitality you can regain as an
Mhm.
older male with lower test. That one,
Huge.
I preach a lot for patients to look into, and even women too. Some people don't
Mhm.
realize that women who do have low test still have a similar symptoms, and when they
Mhm.
get on a obviously very managed dose, can have similar effects of feeling better, vitality,
Yes.
energy, mood. It's incredible, and I think more people need to look into that with less of a negative outlook and
Mhm.
stigma on that kind of treatment. I think
Love
it's
that.
something that we should be putting way more our brain and effort into looking into.
Oh, I love that. Now let's take a different route with exercise and physical therapy, or those type of movements, if we will. You add in NAD, which can help boost mitochondrial health, which then also helps for the energy production and also recovery. Also adding two with reducing oxidative stress. So that will help significantly for overall energy maintenance, recovery, all these types of things that you can find yourself, especially if you work out and you're an older individual, huge effects with that. I think that have a positive effect long term as well.
And I know we know
Mhm.
exercise upregulates insulin sensitivity as well. I'm sure there's a thousands of benefits for exercise that I know we could probably go over and have it be an entire podcast in itself. But I know the main ones that people maybe don't understand as far as why exercise is so dang important is its ability to impact mental health.
Yes.
And there's even research now showing that psychologists are prescribing exercise first line for depression. And
Let's go.
people don't understand that's truly a driver in not only obviously cellular health, but mental health too.
Mhm.
I think that's something that more people need to incorporate into their life for sure.
That's a beautiful point. Now, when we look at the diet, especially a ketogenic diet, or you get into ketosis, which helps promote ketone production, which then is a whole nother energy source that can help boost mitochondrial function. So you add in this supplementation with that, enhancing then cognitive function as well as overall energy. So in terms of brain health, I think with the ketogenic diet, there's probably some awesome positive effects with that. Again, person dependent on that one, but yeah,
I
that
know
would
one of
be
the
interesting.
quickest ways to lose weight is on a ketogenic diet. It's a little more difficult than most diets, but I do think that one you feel much better quicker
Hmm.
if you are willing to put in the struggle and effort, sacrifice.
Hmm.
But I do know that those that are sticking to some type of diet like that, they're the ones saying that was one of the more effective diets that they've ever tried. Now, long term, it can be tough to stick to, but I know that improving any cognitive change along with improving ketone function, elevating
Hmm.
NAD levels and things like that. People experience such more clarity, less fogginess when they go on a keto diet.
Hmm.
Plus, obviously, when you start losing weight, you're going to have more energy. You're
Yes.
going to have all these other changes too. And that, if you want to get started on a keto diet, I'm sure there's a few people that you can look into. I know Dave Asprey was one of the first ones to talk about it in his books. I can't remember if there's anybody else that have talked about keto diets too, but we did a lot of keto diets in our clinics as far as the foundational diet for patients, and that was our favorite one, just because it was so effective and people want results quickly, of course. It did help that in that, but it also caused a lot of people to quit early because they just couldn't stick through it. But
It's hard to get into ketosis, like for a lot of people.
for sure,
And that energy and resilience mentally is a whole barrier in itself.
for
but
sure.
I love it too.
But when you can see the results quicker, I think that gives you that motivation, momentum to build off of versus having to wait longer for it. But yeah, absolutely.
Good, very good point. Okay, now let's look at the route of like neurotropics or neuroprotective supplements, whether it's ginkgo biloba or whether it's even omega-3 fatty acids too, all of which will have and support mental cognition, memory, focus, and also helping with inflammation or a neuroinflammatory state as well. So that would be something to start thinking about to help protect the neurons from any degeneration long term, especially for older individuals as well.
Omega-3 too is profound effects on joint health and skin health, actually. And there's so many other things too that everyone, if you don't eat fish, you should be taking at least an omega-3 every day, for sure.
And I think we're at a point to where most people are able to take that supplement with no side effects, other than the taste for some people they don't like. But
and if it's coming from a good source, usually you don't have that issue. Just something to think about when you're looking to invest in an omega-3 fatty acid.
Absolutely. Now, with this next one, this DNA repair and telomerase activators. So when you activate the telomerase, it helps for the lengthening of telomeres, which helps for the protective caps on the chromosomes, which will then subsequently help for the DNA stability, if we will. You add on the NAD support with that for the DNA repair, and those type of mechanisms will work almost synergistically for the delay of cellular aging, thus helping longevity as well. There's definitely more research that needs to be on some of these applications, but interesting.
Research, like you said, so many are putting their money on telomeres in regards to aging and longevity, saying that this is the fountain of youth area to research as far as telomeres go. So I know so many are looking at what can improve telomere length and prevent any degradation. And I know that's where they're focusing on within the next 10 to 20 years. And I know that there are some things that you are probably doing that you don't even realize are helping with your telomere lengthening, like cold plunging. They've shown that it can possibly impact that, saunas, all those other things too. But yeah, no, that's great.
Shoot, since we're on that, whether it's cryotherapy or heat therapy, I mean, adding NAD into that too will have almost stimulate a stress response in the body, which then leads to the mitochondrial health.
I know it helps in improving brown adipose tissue production, which also is a great regulator of mitochondrial health and energy function too. I know we talked a little bit about that on one of our pods, but I know that we've talked about adding in some upcoming pods regarding cold and heat therapy. So if you guys are interested, let us know, because we are thinking about absolutely doing that. I think that'll be a good one. Now, let's say someone really does want to dive into this. Do you have any recommendations for doing IV somewhere, and what you would maybe think about prior to doing that? Or if you wanted to purchase a supplement, where would you start there? Anything that you can give to anybody listening that has, I guess, is ready to jump in and do some things like this?
Yeah, so I would look at a couple things. If you're going to go supplementation route, which is the cost-effective route, I would look at NMN more so than NR. I would also look and see on the labels, does it store in the fridge? Especially from my past experience, I don't know what it is or the reason why, but I'd try to find an NMN supplement that needs to be stored in the fridge, and I'd look to take and use that on a consistent basis, probably for a good month or two. Take a good month off and then add that back in as well. So that'd be where I'd look at supplementation route. Now, if you want more effects, especially faster effects, I'd go NAD therapy through the IV. For that, you're going to find that some pain management clinics, some clinics that just have it's almost like IV clinics to a certain extent, or have those services. There's oftentimes they have NAD with certain cocktails, if we will,
Yeah, yep.
whether it's with different vitamins, different types of things that can help for the overall function. Sometimes they're able to add in the NAD with other concoctions, if we will, but that would be the other place I'd look at, especially if cost is not a factor to you as much. I'd go IV more than supplementation.
Sure, sure.
But just start looking around, or even if you want to type into a Google search or a search engine and saying NAD therapy, NAD IV, there's probably going to be a bunch that come up. I'd look up what website looks like they have more information on that topic. Go ask and do a consult with them and asking a bunch of different questions in terms of what results have you seen in the past for certain people with this or with this NAD therapy, with this other concoction. That'll give you a good understanding. So that's what have you found or what have you seen with some of this stuff from either past people you've heard from or?
Yeah, I think for myself, if I was going to do something like this, I would look for a provider more than maybe an IV therapy
Okay, I love that.
place. I don't know if you'd call it a clinic, but
Yeah.
wellness area. Specifically, I want to make sure I work with someone who's more scientific about it, like a functional provider who is actually thinking about my specific thing that I'm trying to get help with, versus more of a just general, you go in, you get the IV, you leave a thing where there is probably a lot of monitoring. The protocol is probably very general, and it's just something that they do with everyone, versus someone who comes in to a provider who says, no, this is the kind of protocol that you need, dosage you need, this is how long we're going to do it for, this is what we're going to measure. You're just going to find better results with someone who's done it that way. So that's where I would start if I wanted to do the IV. As far as supplementation goes, like Doc said, the higher quality, the better. Look into who else is using it on Reddit or other things like that. And hopefully down the road, we can pair up with some companies, if anybody's listening, who you want to shoot us some plugs. Because, yeah, again, I'm excited to look more into the companies that are putting out good quality supplements for people. And obviously, if you're seeing results with a certain one, let us know, because we want to make sure that we can, provide that for people that are listening. But I myself, I've only used one that was True Niagen, the NR supplement. I did see change, but I'm curious about trying more now. Like you said, some you saw change, some you didn't.
Yep.
And just I'm going to look a lot into what other other people using and what are effects. I also have never done the NAD IV, which I'm super excited to try too.
No, I thank you, Doc. I like that perspective too, especially with the experience that you have with that, and even the fact that you look at the provider more so than just the actual what service. I think that is way smarter idea as well too.
For sure.
Now, I like that you put this segment together, NR versus NMN, and some of the misunderstandings. I think this is going to be perfect for a lot of people and can answer a few different questions that people may have. So what have you saw in terms of differences between NMR, NMN, especially either whether it's vitamins or whatever else?
Yeah, so there are, I'm not going to say where this came from. I don't want to single out any one company, but there was this kind of list of claims regarding NR versus NMN and all these things. And I just wanted to make sure people know that there are plenty of companies out there looking to lie to you. Strong word, but yes, lie to you and to show you that their supplement is better than the other. And today's pod was really just diving into the benefits of all of it and knowing where to maybe start for you and just why you'd want to do that. But let's go away from NAD IV. Let's say you really just don't want to do IV. And this is maybe something instead you want to try as far as supplementation goes. So why would you choose one versus the other? The first claim on this one website was NR is a vitamin and NMN is not. True, but there's some clarification needed. NR is a form of B3. However, NMN is an intermediate to NAD plus biosynthesis. It's not classified as a vitamin. Both contribute to NAD plus levels, even though NR is only considered a vitamin. But what you need to understand is there are human clinical trials on NMN that demonstrate increases in NAD plus, like we've talked about prior, and both have showed positive results. So whether you want to start with NR or whether you want to start with NMN, I don't think there's no true negative outcome that you're maybe experiencing with each of them. Go ahead and give each a try. But Doc said NMN is maybe more promising, and we would obviously recommend that you maybe something you try first. But the second claim was NR can enter the cell and NMN cannot, which is actually not true, incorrect. NMN can indeed enter the cells directly, especially in mammals, through a specific transporter known as, I think it's SIC12A8. And yes, I don't need to get into the specifics of that, but both can enter the cell, both can improve cellular change and improve NAD improvement. Third claim, NMN makes NAD in 3 steps. NR only requires 2. Partially true, but misleading. NR indeed converts into NMN into the cell and then into NAD+. It does follow a 2-step pathway. NMN does not convert into NR outside the cell in order to enter, actually. It can enter directly through the transporter that we just talked about. Number 4, NR has 4 published human studies. NMN has 0. This is completely false. There are published human clinical studies for both NR and NMN. Both, again, show positive change in NAD+ levels and obviously other things associated with that. That one is just a blank lie. NR is taken orally. NMN is mostly studied by injection. Partially true, but incomplete. Many early NMN studies in animals used injections, but recent human studies actually showed NMN administered in oral form. And that's where I think they're just trying to get you to worry that you'd have to do this by injection versus just taking it orally. So that's completely untrue. I do know plenty of good companies out there that do NMN orally, and I know that the effects are great too. NR increases NAD by up to 60%. NMA may not. This is misleading. NR has shown an ability to increase NAD levels by 60%. However, NMN has also demonstrated similar effects in human studies. 7, NR has at least 4 published trials confirming it safe for humans. NMN has 0. Both, again, supremely false. Both have demonstrated safety in human trials. NR has a longer history of human testing and published safety data, but NMN has also been found to be safe and well tolerated in human trials. And then the last one, NR has 3 FDA safety notifications. NMN has 0. This is true, but you need to understand the context of what they're saying. That doesn't really give you a lot of anything really beneficial to have this, because safety notifications don't really have any weight, as far as meaning that you don't have FDA approval having a safety notification. So they basically went through, FDA reviewed it and said, yep, it's safe as far as how they created the supplement and it's okay to be consumed, but there's no FDA approval. There's no it's not available as an FDA approved supplement or drug. And there's really no weight to what they were saying as far as that goes. What you can conclude from that is, right now, even though that there maybe is some differences in research regarding the two, both can be used to benefit your outcomes. And I don't think there's one versus the other right now that we know is more beneficial, other than just we have some promise for NMN versus NR. But again, I would try both. I really wouldn't have a reason to not try one or the other.
Absolutely. For me, it would almost be, the reason why I went NMN supplementation myself instead of NR was because it was further down the pathway to NAD, which takes less steps to get to NAD versus NMR.
Absolutely.
In terms of that progression. So for some people, you might notice better effects just because that, and there's probably going to be very slight from NR versus NMN. But yeah. Now, Doc, I know you brought up Dr. Conover's past, either way it's literature, past experience. What have you found with him in terms of what protocols he uses with NAD therapy?
This is really fun, I think, to now talk about how to include this in your own protocol, or what you can even look towards as far as, let's say you maybe have a little bit of a choice if you go into, let's say, like an IV place and they don't have any like general protocols. So maybe you can at least have them help you, through these kinds of phases. I, again, would rather have you work with a provider who's done all of this for sure, because he's obviously a very gifted doctor who's done this for many years. And so you got to take that into consideration too. But he does a protocol where he starts with a loading phase. And this loading phase is an IV NAD. It's daily for a span of 4 to 5 days. And then as those NAD levels rapidly elevate, you'll just see such a huge change in people's symptoms. and the dose is usually 500 to 1,000 milligrams per infusion. He said 750 was actually the sweet spot that he's found. He'll usually start with 750.
Okay.
He'll obviously assess what your tolerance is, what other your potential side effects, like we've talked about, is nausea, flushing, chest tightness that can possibly occur. So if that is something you're not able to tolerate, he'll obviously lower your dose or change if needed. And then sessions can be anywhere from, it says 1 to 4 hours, but I think on his last, he tries to shoot for an hour. He doesn't like the 4-hour sessions anymore. He used to do 4 hours, but now it's about an hour, where he just said 4 hours was just way too long, and he tries to shoot for an hour now.
Is there a reason why he goes into a loading phase before maintenance?
I think functionally, he loves to get people get results as quickly as possible, so they feel better about themselves. They can ride that momentum. They start to feel better about themselves. And some of these loading phases that he started with were for patients that were going through addictive changes. So he was like, we urgent, like dire stress. This is where we really need to get change quickly. But what he would see is all these other things that would happen positively for them, other than just coming off of addiction. I think this is a great way to get your feet in, dive in head first. And yes, you're going to experience some side effects, but the reward on the end of this sacrifice is very impressive in my opinion. So after you do the loading phase, there is a maintenance phase where he does maybe like 1 to 2 infusions per month. Sometimes he'll do oral NAD after that. He actually has done both, NMN or NR, and he even recommends to do those oral supplements between NAD sessions IV, just to help utilize while you're away from the clinic. Some other things that he recommends adding in on top of those NAD IV sessions would be methylated B vitamins. He talks about methylated vitamins a lot. He said that there's a lot of humans who can't methylate very well, and it's getting more and more prevalent in society. So methylated B12, methylated folate. He also talks about trimethylglycine, which can help with, again, the methylation pathways. He also talks about vitamin C, glutathione, CoQ10, L-carnitine, all other things that can improve outcomes there. And then lastly, like we've talked about, he talks about fasting, exercise, and sleep management, which I think we don't have to go too much into that. People can look at our past pods to just see really the improvements there. Cool. Yeah, I would say well over 80% of people are going to see huge change doing a protocol like that. Oh, I want to do a protocol like that. I think that'll be super cool to see the outcomes.
No, I love that. Now, going back, so I love how Conover has a bunch of experience, and I like how he put that into almost like you get everything ramped up, and then you can maintain those levels, whether it's supplementation or IV 1 to 2 times a month. Really smart on that, and then maintaining that as well. Now, let's say going back to Dr. Sinclair and some of his work, especially through Stanford, and he's still doing research on like DNA and different ways that you can help improve the lifespan long term. I guess, what have you looked at through some of his lines of literature?
Yeah, he likes to take NMN daily, 1 gram of NMN every morning. He prefers NMN. NR is something that obviously we've talked about you can use too, but he's all in on NMN, and he finds it to be the superior oral supplement. And like you said, just how much he's dove into this research, I would trust his opinion. And if I were to jump in, actually just talking out loud, I do want to try this. I'm going to try NMN first. That's just something that I think is, after reading this research, going through all this with you, hearing everything from providers to research, NMN is really where I want to start. So he does 1 gram of NMN every morning. He also likes to do resveratrol, like we've talked about. Trimethylglycine was another one. I think Conover did that one as well. Metformin, 500 milligrams daily. Again, I don't think he uses it because he has diabetes. I think he obviously uses it for the longevity benefits. Yes. He also uses quercetin and fisetin, which are senolytic compounds. Again, to help with clearing senescent or aging cells, which again just supports overall cellular health. Lastly, he's very big on intermittent fasting, obviously regular exercise, and then cold exposure. He has started to talk a lot more on, which I freaking love cold exposure. I think it's one of the quickest ways to impact not only your not only this area of health,
Mhm.
but mental health and
Yes.
stress resistance and energy. I love it. And I think it's something that a lot of people, if they didn't incorporate that into their life, would have profound effects for sure.
Let's go.
Doc, anything that you took away with Sinclair's work that maybe we
Mhm.
didn't touch on today? I know you've read a lot
Yeah.
of his stuff.
And some, it's been, gosh, a couple years since I dove into some of this myself. But yeah, the thing that I took away was, I know I touched on his dad and him and just the overall maintenance long term of their body. I think if certain people want to have a longer lifespan, if certain people want to improve the function and quality of their life long term, this is something that I would significantly start thinking about, and diving into yourself, and or dabbling with certain areas of supplementation. I think that's where I'd go. I think definitely we should probably use this way more for a lot of the patients now, going back through some of this stuff and creating different protocols for ourselves as well. But yeah, I think we touched on some of the main points. And I know Dr. Sinclair, he's doing more updated literature, and he put out, like I said earlier in the podcast, like a series of 4, 5-ish, I think, or so videos on more in-depth reasoning of sirtuins, more in depth of the DNA spools tightening up. So if you want to dive into that a little bit more, he'll be the best resource that I've come across in terms of how to explain it. But I think there's still more as he comes up with better research and protocols. We're only going to benefit from
Yeah.
there as
And I
well.
think his book is titled Lifespan, I believe it's
Yeah.
called.
Yep.
You can also, he really goes
Mhm.
down a lot of, I say, rabbit holes of categories and research. But it's if you're into that kind of thing,
Mm.
I know he provided substantial amounts of information in that book.
Yes.
I scratched the surface reading, skimming it,
Mm.
but I've done that a couple times now, and I know that it's chock full of a lot of good information. And I know Conover states that he was one of the first to do NAD IV therapy in the United States.
Cool.
He started using it with a gentleman who did it first in Mexico, and then the gentleman from Mexico brought it into the United States and asked Conover to help him ramp it up, build protocols, study it, research, all those kinds of things. You have Sinclair, who's behind the true research, understanding information. Then you have clinical, where Conover, I think, is
Mhm.
taking and really creating those awesome protocols. So I think both great resources, and those are going to be the two that I'm going to continue to follow as far as more information comes out.
Yes. And you fast forward a couple years, I'm sure there's going to be a lot more of awesome studies coming out in terms of application for other conditions long term.
Yeah.
We're excited to see how some of that comes out from
Absolutely.
there. So
And the only last thing I think to add for me would be I don't believe this is an insurance covered treatment. I don't know if you're going through this podcast thinking that, but very much a cash based service. But it's one where I think if you can invest your funds into something like this, you are going to receive far better outcomes than any insurance covered treatment, especially for some of the things that you'd be using it for. Yes, unfortunately, it requires some of that as a sacrifice too, but this is your health, this is your life. We just can't stress that enough. This is
Mhm.
something that I think you and I have been doing long enough to just see should be a priority in people's life, and people aren't prioritizing this enough. It's just only going to improve the quality of your life. And if you aren't prioritizing it, I highly recommend that you think twice about spending maybe money on other things that don't benefit you in this category.
Absolutely. And if you yourself, or with someone who has tried supplementation, IV, NR, NMN, NAD, comment down below. What's your experience been like? We're always looking for like past case trials of what people have been through, so we can have a general understanding. So by all means, share to those individuals, like, subscribe, all that fun stuff.
Thank you guys so much for watching. We hope you've taken a good amount of information from this, a lot of value. Please, again, let us know what you're thinking. And then, of course, let everybody else know by sharing this. We really appreciate it. And until next time, Doc,
Absolutely.
you guys have a great day.
Woo!
Disclaimer: the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment.
Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on the Functional Code. For more evidence-based health insights, subscribe, rate, and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.